Okay, good. Good day, everyone. Today we will explore microbial diseases that affect the digestive system. So we will begin with the structure and function of the digestive tract, then move into the normal microorganisms that live in our body. After that, we will examine infections, both upper and lower digestive infections. These are caused by bacteria, viruses, and even protozoa. Okay, so as seen in this diagram, the digestive system starts from the mouth and extends from the mouth, extends to our anus. So from the mouth up to it reaches the anus. So each organ from esophagus to the intestines plays a role in digestion and absorption. So understanding this pathway helps us identify where infections occur and how pathogens affect specific organs. So we have what we call the normal flora. Not all microorganisms are harmful. In fact, many microbes in our mouth and intestines are actually beneficials. So they help synthesize vitamins, break down indigestible food, and prevent harmful pathogens from taking over. So this balance is important for maintaining digestive health. Now let's go to the upper digestive infections. So upper digestive infections affect the mouth and the throat. So these can be bacterial, such as dental caries, and also periodontal disease, or viral like mumps. So we will examine each condition and how they develop. So let's go first to the tooth decay or dental caries. So this one is mainly caused by Streptococcus mutans. So these bacteria use sugar to produce acids that damage tooth enamel. Now, prevention includes limiting sugar intake and using fluoride to strengthen teeth. Next is the periodontal disease. This one is involves inflammation of the gums due to plaque bacteria. If untreated, it can lead to tooth loss. So a key bacterium involved is Porphyromonas gingivalis. So proper oral hygiene is essential to prevent this. Next is the trench mouth. So the trench mouth is a severe gum infection caused by a combination of bacteria. So it leads to painful bleeding gums and is often linked to poor oral hygiene, and it can affect individuals of any age. Okay, so summary of teeth and gum infections. So this table compares dental caries, periodontal disease, and trench mouth. Notice the says differences in symptoms, causes, and prevention. So this helps us understand how each condition progresses and how they can also manage. Now, I mentioned to you about mumps a while ago. So, mumps is a viral infection caused by a paramy, paramysovirus. Paramysovirus. It enters through the respiratory tract and can affect the salivary glands, your brain, and even reproductive organs. So, vaccination through MMR is the best prevention for this. Now, the features of moms are actually listed in these um, slides, and we see that that includes swelling of the parotid glands and fever. The virus spreads through the bloodstream and can affect multiple organs. So humans are the only source, making vaccination very important. Let's jump now to the lower digestive infection. Now, these include bacterial diseases like cholera, and salmonella, salmonellosis, viral infections like rotavirus, and protozoan infections like Giardiasis. So let's start with the Helicobacter peptic ulcer disease. So this disease is caused by Helicobacter pylori. So it damages the stomach lining, leading to ulcers. So the bacteria survive stomach acids by producing enzymes that neutralize it. So features of Helicobacter gastritis are the symptoms include abdominal pain and possible bleeding. So transmission is often fecal oral. So treatment usually involves antibiotics and medications to reduce stomach acids. Next, shig, shigellosis. Symptoms include fever, diarrhea, and abdominal pain. It spreads through contaminated food and water. Proper sanitation is key in prevention. So these are the features of the shigellosis. And as I mentioned, this one is caused by Shigella bacteria, and that produces toxins that damage the intestinal lining. So this results in the inflammation and bleeding and leading to dysentery. Next, salmonellosis. So salmonellosis, this infection is caused by salmonella. So it can lead to food poisoning or typhoid fever. So severe cases may result in septic shock due to the toxin. For the features of salmonellosis, this includes the diarrhea, the vomiting, and fever. So it is commonly transmitted through contaminated food, especially poultry. So proper cooking reduces risk. So when you do some gipsal, see to it that you're cooking it well. When you buy barbecue outside, uh, just remember if it is meat, it needs to be cooked well. Next, cholera. So cholera is caused by Vibrio cholerae. So its toxin causes cells to release large amounts of water and electrolytes, so leading to severe dehydration. So for the features of cholera, it's listed here, and that includes the rapid diarrhea, dehydration, it spreads through contaminated water, and treatment focuses on rehydration therapy. Next, gastroenteritis. Gastroenteritis refers to the inflammation of the stomach and intestines. It can be caused by different bacteria like E. coli, Campylobacter, and also Bacillus cereus. What is E. coli or Escherichia coli? So, this strain of E. coli can cause severe diarrhea. So, some produce toxins while others invade intestinal cells. So, it is commonly associated with contaminated food and water. So, features of Escherichia coli. No, let me just. Okay, so in here, symptoms include diarrhea and vomiting. Prevention includes proper hygiene and also food safety practice. Go, hold on a bit. Okay, let's go now to the next one, the Campylobacter gastroenteritis. So this is one of the most common causes of diarrhea. It is often transmitted through contaminated milk or poultry and requires only a small number of bacteria to cause infections. So features of it include symptoms like diarrhea and fever. In rare cases, it can lead complications like Guillain-Barré syndrome. So other gastroenteritis causes include this one. These causes can be include Yersinia, Clostridium, Perpigans, and Bacillus cereus. So these bacteria often produce toxins that cause food poisoning. Next, rotavirus. Rotavirus is a major cause of diarrhea in infants and children. So it spreads easily and has a short incubation period. Next is giardiasis. So giardiasis, this is a kind of infection caused by Giardia lamblia, usually from contaminated water, and it exists in two forms. It could be trapezoid and also cyst. Features of Giardiasis. Symptoms range from mild discomfort to severe diarrhea. So prevention includes proper water treatment and also hygiene. Cryptosporidiosis. So this disease is caused by Cryptosporidium parvium. So it spreads through contaminated water as well, and it is difficult to filter out. So features of Cristosporidiosis includes a watery diarrhea and abdominal pain. So it is especially dangerous for immunocompromised individuals. Next is amoebic dysentery. So symptoms include watery diarrhea and abdominal pain. It is especially dangerous for immunocompromised individuals, but it can also spread beyond the intestines to the liver, causing serious complication. And by the way, this is caused by Entamoeba histolytica. Features of amoebic dysentery includes symptoms include bloody diarrhea as well, abdominal pain, and it spreads through contaminated food and water. Prevention focuses on sanitation and also hygiene. All right, thank you very much and see you.